Madam Secretary, as you know, in our part of the country, we have a lot of good quality Medicare Advantage. You have programs, for example, like group health in Seattle that are so popular. All the single-payer folks always tell me, whatever you do, just make sure you protect group health. And so I was particularly interested in the numbers that you all have put together that indicate that in the last year, and this is countrywide, not just in the Pacific Northwest, Medicare Advantage enrollment has increased 10% since this time last year, while the premiums have fallen about 7%. Now, this is particularly noteworthy given all the predictions that came up during health reform. What do you think is behind a trend that indisputably seems pretty encouraging?
Well, I think, Senator, it is very encouraging. And the 7% is, again, the decrease in premiums is a national average. In some places, it's significantly higher. And over and above that, I think we're at 99.7% of Medicare beneficiaries have a choice. There are only a very few isolated areas where there isn't currently a Medicare Advantage plan in operation. So I think it's a combination of strategies that were really part of the Affordable Care Act to negotiate for health benefits and look very carefully at pricing strategies of indicating to individuals for the first time we have a quality rating system, and what we're seeing is beneficiaries beginning to make substantial changes on their own based on the quality of those plans. And in this case, I think competition is paying off, but with an announcement that the Medicare Advantage plans on average were being paid about 12% more than fee-for-service Medicare with no resulting health benefits. And I think the market is adjusting to the notion that that payment strategy is coming down.
Let me ask you about one other area, Madam Secretary. I always like to do the positive news first that unfortunately isn't so positive, and that's the question of the drug shortage matter. Yesterday I talked to a father of a 3-year-old in Oregon, and the 3-year-old has leukemia, and the family can't get their leukemia drug through their insurer. Now, the Finance Committee held an important hearing. Chairman Baucus and Senator Hatch have been very interested in this drug shortage, issue. And we were told that, in effect, when the government sees that there's a drug shortage, this was the testimony we had in the Finance Committee, it usually takes a year or longer in order to get the drug out again. And what that tells me is that's too late for many parents. These parents, like the family I talked to yesterday, say the government ought to have resolved this, yesterday, and why can't the government fix this and stop playing catch-up ball? So my question to you on this is, the President issued an executive order on this last fall. What specifically since then has changed so that the government is going to get out in front of this urgent problem? I'm not the only member of the Senate who's hearing from parents. I want to know what I can tell that parent when I call them back tonight. I said I was going to call them back tonight and say that I spoke to the government's point person on this issue. What can we tell that parent tonight that the government is doing to get out in front of this urgent issue?
Well, the good news for the parents of the child with leukemia is that the FDA did announce yesterday that they feel that in the next 2 weeks, the leukemia drug shortage will indeed be resolved. People were afraid they were going to run out of the drug in 2 weeks, and it's resolved because what we can do at the FDA is accelerate alternatives if we have notification. What we know is that since the executive order that the President issued in October, there have been over 200 shortages that actually have been averted because the FDA was notified. They can look for alternative sources of the drugs. They can expedite manufacturing lines in other areas. This really is, though, Senator, unfortunately, a bit of a market glitch where the market capacity for drugs has not increased. There are pipeline increases that are 2 and 3 years off, but currently we have the same manufacturing capacity and drug marketers choosing which line of drug to produce at which time. The earlier we're notified, and you have a bill pending in both the House and the Senate, that we would be eager to work with you. We've done as much as we can administratively, but a mandatory notification of drugs that appear to be getting to a shortage gives us then the ability to put our team into gear, and we can be fairly effective at least finding alternative strategies, trying to ramp up other lines, putting pressure on groups, looking in Europe and Asia for an alternative. But if we don't know that it's coming, there's almost nothing the government can do.
Mr. Chairman, I know my time's expired. I want to only say, Madam Secretary, I don't think notification alone is going to do it. I think this is a question of what kind of incentives we need to get to manufacturers. I think it's a question of the gray market. Just notifying people about what everybody already knows about, I just don't think it's going to do it. The chairman's been gracious in terms of his time. I'll continue this with you because—
Well, Senator, we would love to work with you on this, and I would say that notification is a huge piece of it. It may be one of the few pieces that we at the government can control. Again, looking at the market, which we have done extensively, the manufacturing capacity needs to be increased, and a number of the major pharma companies are in the process of doing that. They're just a bit behind the demand.
I think the government's been behind. Thank you, Mr.
Senator
Chairman.
Colburn.